10 Early Signs of Liver Damage. Ever wondered what your liver might be trying to tell you? The liver, a silent workhorse, plays a crucial role in keeping your body toxin-free and running smoothly. Yet, most of us ignore its early cries for help until it's too late. Today, we're diving deep into the hidden world of liver damage. You'd be shocked to know how subtle yet dangerous the early signs can be. Imagine your body's detox center being under attack, affecting everything from your energy levels to your skin. Ignoring these signals can lead to serious health issues down the road. So, what are these early warnings? And how can you catch them before they wreak havoc on your health? Stay with us as we uncover the 10 early signs of liver damage that you absolutely cannot afford to miss. Your well-being might just depend on it. 1. Jaundice. Let's kick things off with a heavy hitter. If you've ever looked in the mirror and noticed the yellowish tint to your skin or the whites of your eyes, it's not a good sign. That yellow hue is jaundice, and it's like your liver waving a giant red flag. Essentially, your liver is struggling to process and eliminate bilirubin, a yellow pigment that's produced during the breakdown of red blood cells. Think of it as your liver's way of saying, "Help, I'm drowning here." Ignoring jaundice is like ignoring a flashing check engine light on your car. Eventually, things are going to break down, and it won't be pretty. Scientific studies, like those published in the Journal of Hepatology, underscore that jaundice often indicates severe liver dysfunction. It's not just a cosmetic issue, it points to your liver cells being damaged and overwhelmed. But let's dive a bit deeper. Jaundice can also be a symptom of other underlying issues such as hepatitis, gallstones, or even certain types of cancer. Imagine your liver is like a nightclub bouncer. Bilirubin is the unruly guest. When the bouncer is outnumbered or too weak to do the job, the unruly guest causes chaos. That chaos, in this case, is bilirubin flooding your bloodstream, turning you a shade that even a ripe banana would envy. While turning yellow might give you an edge in a Simpsons cosplay contest, it's definitely not something to brush off. It's your liver's SOS signal, and it's crucial to get it checked out immediately. Expert opinions from gastroenterologists emphasize that early intervention can prevent further liver damage and even reverse some of the damage done. In summary, jaundice is not just an aesthetic inconvenience, it's a serious sign that your liver is crying out for help. Pay attention to this yellow warning light, and your liver will thank you. 2. Abdominal pain and swelling. Moving on to our next red flag. Picture this, you're enjoying your day when suddenly you feel a dull ache in the upper right side of your abdomen. Or worse, your belly starts to swell like you've swallowed a balloon. These are not just random discomforts, they're your liver's way of sounding the alarm. When your liver is inflamed or injured, it can cause pain and swelling. The inflammation causes the liver to enlarge, pushing against the surrounding tissues and nerves, which leads to that uncomfortable pain. It's like having a party in a small apartment, too many guests and someone's bound to get elbowed in the ribs. Studies, such as those in the American Journal of Gastroenterology, highlight that this pain can be a symptom of conditions like liver cirrhosis or hepatitis, indicating that liver cells are being damaged or dying. Ignoring this pain is like ignoring a toothache. Eventually, it's going to get worse. Swelling, also known as ascites, happens when fluid builds up in the abdomen, often due to severe liver disease. It's like your liver's plumbing has backed up, and now there's a flood in your abdominal cavity. This is a serious sign that your liver is struggling to function properly and is losing the battle. But let's spice this up with a bit of humor. Imagine your liver saying, "Hey, I'm not just fat, I'm bloated." While the image might make you chuckle, the reality is far from funny. That swelling is your liver's desperate attempt to manage a crisis. Beyond the liver, abdominal pain and swelling can also point to issues like heart failure or kidney problems. It's like when your kitchen sink backs up and suddenly the whole house starts to smell. It's usually a sign of a bigger problem. Experts agree that persistent abdominal pain and swelling warrant immediate medical attention. Gastroenterologists stress that early diagnosis and treatment can prevent further liver damage and improve your prognosis. Ignoring these signs can lead to more severe complications, including liver failure. So, if your abdomen starts to protest loudly, don't ignore it. Listen to your body's complaints before it stages a full-blown rebellion. Your liver might be giving you the most crucial heads-up of your life. 3. Chronic fatigue. We all feel tired from time to time, but when that exhaustion doesn't go away with a good night's sleep, it might be more than just a busy lifestyle. Your liver could be crying for help. Chronic fatigue can be a significant indicator of liver trouble. The liver is essential for detoxifying your blood, producing vital proteins, and storing energy. When it's not functioning properly, your body is like a factory with half its machinery broken down. Everything slows, and you end up feeling constantly drained. Research published in the Journal of Hepatology suggests that chronic fatigue is a common symptom in patients with liver disease, especially in conditions like cirrhosis or hepatitis. It's your body's way of telling you that it's running on empty because the liver can't keep up with its workload. Ignoring this sign is like driving a car with the fuel gauge on empty. You're not going to get far before things come to a halt. Fatigue can often precede other more severe symptoms, indicating that the liver is struggling and potentially failing. It's not just about feeling tired, it's about your body not having the resources it needs to function properly. Imagine your liver as the office coffee machine. When it's in good shape, everyone's happy and energized. But when it breaks down, productivity plummets, and chaos ensues. Chronic fatigue is like working in an office where the coffee machine is always on the fritz. Besides liver issues, chronic fatigue can also be linked to other conditions such as anemia, thyroid problems, or even sleep disorders. However, if you find yourself perpetually exhausted without a clear reason, it's crucial to consider your liver health. So, if you're feeling like a zombie despite getting plenty of rest, it might be time to think beyond your sleep schedule and check on your liver. Ignoring chronic fatigue won't just leave you yawning through the day, it could be a sign that your liver is desperately asking for help. 4. Nausea or vomiting. While it's easy to brush off an upset stomach as something minor, persistent nausea or vomiting can be a clear signal that your liver is in distress. Your liver plays a key role in digestion and detoxification. When it's failing, toxins build up in your bloodstream, which can lead to nausea and vomiting. Imagine your liver as the body's sanitation department. When the garbage collectors go on strike, trash piles up everywhere, creating a toxic environment. This is exactly what happens inside your body when your liver isn't working properly. Studies in the Clinical Gastroenterology and Hepatology Journal highlight that nausea and vomiting are frequent symptoms in patients with advanced liver disease, signaling that the liver's detoxifying abilities are compromised. Ignoring this symptom is like ignoring a leaking pipe in your house. The longer you wait, the more damage it causes. Persistent nausea or vomiting can indicate serious conditions like cirrhosis, liver failure, or hepatitis. It's your body's way of showing that your liver is struggling to keep up with its critical functions. Think of your liver as the overworked chef in a busy restaurant. When the chef is overwhelmed, meals start coming out poorly, or not at all. Nausea and vomiting are like the undercooked dishes that make it to the table. They're clear signs that something is seriously wrong in the kitchen. Beyond liver issues, nausea and vomiting can also be caused by a variety of other factors, such as gastrointestinal problems, infections, or even medication side effects. However, if these symptoms are persistent and unexplained, it's important to consider your liver health. Experts strongly advise against ignoring chronic nausea or vomiting. Hepatologists note that these symptoms, when coupled with other signs of liver distress, should prompt immediate medical evaluation. Early detection and treatment of liver disease can prevent further deterioration and improve long-term health outcomes. So, the next time you feel persistently queasy, don't just reach for the ginger ale and crackers. It might be your liver's way of sending out an urgent SOS. Ignoring it could lead to more severe health issues down the road, so it's better to get it checked out sooner rather than later. 5. Loss of appetite. If food has suddenly lost its appeal and you're skipping meals more often than not, your liver might be sending a distress signal. Loss of appetite can be more than just a fleeting issue, it can indicate significant liver problems. The liver is essential for metabolizing nutrients and maintaining energy levels. When it's compromised, your body's ability to process and utilize food diminishes. This often leads to a reduced desire to eat. Research published in the World Journal of Gastroenterology shows that loss of appetite is a common symptom in those with liver disease, such as hepatitis or cirrhosis. It's like your liver is on strike, unable to keep up with its critical tasks, and as a result, your body loses interest in fueling up. Ignoring a persistent loss of appetite is like ignoring a smoke alarm. It's a clear sign that something potentially dangerous is happening inside. Without the proper nutrients, your body can't function optimally, and if liver disease is the root cause, it's likely worsening as you continue to avoid food. Besides liver issues, loss of appetite can also be linked to a variety of other conditions, including infections, cancers, or even psychological factors like stress or depression. However, if you notice a persistent and unexplained decrease in your desire to eat, it's crucial to consider your liver's health. Experts in hepatology stress the importance of not ignoring a prolonged loss of appetite. According to studies and clinical observations, this symptom often precedes more severe signs of liver failure and can indicate that the liver is already significantly damaged. Early detection and treatment can make a huge difference in outcomes. So, if you find yourself pushing away your favorite meals, it might be more than just a passing phase. It's worth paying attention to what your body is trying to tell you. 6. Dark urine. Not exactly a glamorous topic, but your bathroom habits can reveal a lot about your liver's health. If you notice your urine turning a darker shade, it might be more than just dehydration. It could be a sign that your liver is in trouble. Dark urine is often a result of high levels of bilirubin, a yellow compound that occurs during the normal breakdown of red blood cells. Your liver usually processes bilirubin, but when it's not functioning properly, bilirubin levels increase in the blood and get excreted through the urine, turning it dark. Studies in the Journal of Hepatology emphasize that dark urine is a common symptom in various liver conditions, such as hepatitis, cirrhosis, and bile duct obstruction. It's like your liver's way of sending out a distress signal: I can't keep up with the detox workload. This symptom can indicate serious liver damage and should never be overlooked. It's a sign that your liver is struggling to perform its essential functions, and bilirubin is starting to build up in your system. Think of your liver as the body's janitor. When the janitor goes on strike, the garbage piles up, and everything starts to smell. Dark urine is like the overflowing trash bins, an obvious sign that the cleanup crew, your liver, isn't doing its job properly. Besides liver issues, dark urine can also result from other factors like dehydration, certain medications, or foods. However, if it persists despite staying well hydrated and making no changes to your diet or medication, it's time to take it seriously. Medical experts advise that persistent dark urine warrants immediate attention. Hepatologists note that this symptom, when accompanied by others like jaundice or abdominal pain, could indicate advanced liver disease. Early diagnosis and treatment are crucial to preventing further liver damage and complications. So, if you're noticing that your urine resembles dark tea rather than lemonade, don't just chalk it up to a fluke. Pay attention to what your body is telling you. Getting your liver checked could be the key to nipping a serious problem in the bud. 7. Pale stool color. Now, let's discuss a sign that's often overlooked but critically important. It might not be a topic for dinner conversation, but the color of your stool can tell you a lot about your liver's health. Normally, bile produced by the liver gives stool its brown color. When the liver is not functioning properly or bile ducts are blocked, bile can't reach the intestines, leading to pale or clay-colored stools. This is like the liver's way of waving a red flag. Research in the Journal of Gastroenterology and Hepatology highlights that pale stools are a significant indicator of liver diseases such as hepatitis, cirrhosis, and bile duct obstructions. It's your liver's SOS, signaling that bile flow is interrupted. Other underlying issues can also cause pale stools, such as pancreatic problems or gallbladder diseases. However, if this symptom persists, especially in combination with other liver-related signs, it's essential to take it seriously and consult a healthcare professional. Experts emphasize the importance of recognizing pale stools as a potential warning sign. Hepatologists and gastroenterologists agree that early detection and treatment of liver issues can prevent more severe health problems down the line. So, if you notice a change in your stool color to a pale or clay-like shade, don't ignore it. It might feel awkward to discuss, but your liver is too important to overlook. Addressing this symptom early can help prevent more serious liver damage and keep your body's detox center running smoothly. 8. Swelling in legs and ankles. If you've noticed your legs or ankles looking puffier than usual, it might not just be from a long day on your feet, it could be a sign that your liver is in trouble. Swelling in the lower extremities, known as edema, occurs when excess fluid builds up in the tissues. When the liver is damaged, it can lead to decreased production of proteins like albumin, which helps keep fluid in your bloodstream. Without enough albumin, fluid can leak into surrounding tissues, causing swelling. Research in the Journal of Hepatology indicates that edema is a common symptom in patients with liver cirrhosis and chronic liver disease. It's your liver's way of saying, "I'm struggling to keep things in balance here." Ignoring this swelling is like ignoring a slow leak in your home, it's only going to get worse. Persistent swelling in the legs and ankles can indicate advanced liver disease and can lead to more severe complications if not addressed. This isn't just about comfort. It's about your liver's ability to function properly and maintain the necessary balance of fluids in your body. Think of your liver as the body's water regulator. When the regulator malfunctions, you end up with flooding in the basement, your legs and ankles. It's a sign that the liver isn't managing fluid levels correctly. Besides liver issues, swelling in the legs and ankles can also be caused by other conditions such as heart failure, kidney disease, or even certain medications. However, when paired with other liver-related symptoms, it's a clear indication that your liver needs attention. Medical experts emphasize the importance of not ignoring this symptom. Hepatologists and other healthcare professionals agree that early detection and treatment of liver-related edema can prevent further liver damage and improve overall health outcomes. So, if you find your legs and ankles looking more like balloons than limbs, don't just chalk it up to a long day. It's crucial to consider your liver's health. Getting this symptom checked out could be key to catching a serious liver problem early and taking steps to mitigate it. 9. Itchy skin. It might seem like a minor annoyance, but persistent itching can be a sign that your liver is in distress. Itchy skin, or pruritus, can occur when your liver is failing to properly filter toxins from your blood. One key culprit is bile salts. When your liver is damaged or bile ducts are obstructed, these salts can accumulate in your skin, causing intense itching. Studies published in the American Journal of Gastroenterology highlight that pruritus is a common symptom in patients with liver disease, particularly in conditions such as cholestasis, cirrhosis, and hepatitis. It's like your liver is waving a giant flag saying, "Help, I'm overwhelmed here." Itchy skin can also be related to other conditions such as allergies, skin disorders, or even kidney problems. However, when it's persistent and unexplained, it's crucial to consider your liver's health. Ignoring this symptom can lead to more severe liver damage and complications. Medical experts stress the importance of addressing chronic itchy skin. According to hepatologists, this symptom, when seen alongside other signs of liver disease, should prompt immediate medical evaluation. So, if you find yourself scratching incessantly without relief, it's time to look beyond your skin and consider what your liver might be trying to tell you. Your liver works hard to keep your body toxin-free, don't ignore its cries for help. 10. Easy bruising or bleeding. If you notice that you're getting bruises from minor bumps or bleeding more than usual from small cuts, it's not something to shrug off, it could be a signal that your liver is in serious trouble. Your liver produces proteins essential for blood clotting. When the liver is damaged, its ability to produce these clotting factors diminishes, leading to easy bruising and excessive bleeding. Research in the Journal of Hepatology points out that impaired clotting is a common symptom in advanced liver disease, such as cirrhosis and severe hepatitis. It's like your body's internal Band-Aid factory is going out of business. Ignoring this symptom is like ignoring the cracks in a dam. They may start small, but they can lead to a catastrophic failure. Easy bruising and bleeding indicate that your liver's ability to function and heal is significantly compromised. This isn't just about aesthetics, it's about your body's ability to recover from even minor injuries. Think of your liver as the glue holding everything together. When the glue runs out, everything starts falling apart. Those unexpected bruises are like your body's way of saying, "We're out of tape here." While other conditions, such as vitamin deficiencies or blood disorders, can also cause easy bruising and bleeding, persistent symptoms should prompt a closer look at your liver health. It's a red flag that your liver isn't keeping up with its essential functions. Experts emphasize the urgency of addressing this symptom. Hepatologists agree that easy bruising and bleeding often indicate advanced liver disease requiring immediate medical attention. So, if you're noticing more bruises or finding that small cuts bleed longer than usual, don't just attribute it to clumsiness or aging. It could be your liver's way of sending out a distress signal. As we wrap up our deep dive into the 10 early signs of liver damage, let's take a moment to recap the crucial points we've covered. From jaundice and abdominal pain to chronic fatigue and dark urine, each symptom is a critical clue that your liver might be in distress. Remember, early detection can make all the difference. Your liver is a powerhouse that keeps your body running smoothly, and paying attention to these signs can help you protect it. If you found this video helpful, don't forget to hit that like button, share it with your friends, and leave a comment below with your thoughts or questions. And of course, subscribe to our channel for more health tips and insights. Your support helps us create more content that matters to you. Thank you for watching. See you in the next video.